I try to put all my patients with pain, be it nerve pain or arthritis pain, on baseline control of inflammation with natural products, in the hopes that they will end up taking the synthetic drugs less often and at lower doses. And by and large, it's borne out and it works. So tart cherry extract, turmeric, palmitoyl ethanolamide, we talked about that. NMN is a precursor of what's called NAD, which is massively important to the bioenergetics of the cell. I don't know, way back in the earlier part of the talk, I told you about mitochondria needing to be productive to produce energy for that sodium pump to work, and obviously for other things to work in the nerve cell. If you don't have enough NAD, then you don't have enough ATP and nothing works right. And as we age, we get less and less NAD. So I take NMN every day just to get that up, just to optimally function. Glycemic control, can't stress it enough. This is where you have your metformins, your Ozempic, all these drugs that are meant to manage diabetes. Well, you can get it naturally through a substance called berberine, which is a type of a tree bark. It works just as well as metformin. That's been shown in multiple preclinical and clinical studies. And it's natural. And we have one in our product line. You can get it over the counter. Just make sure it's, it is what it's supposed to be. And then, of course, mindfulness and meditation, the progressive muscle relaxation we talked about, the transcendental meditation. And then if you can get into a good cognitive behavioral or mindfulness-based pain therapy protocol. All of these are natural ways that in studies have worked as well or better than those other drugs I talked to you about. And these are way safer. And the side effect of all of this is better vascular health, better brain health, more longevity, better function, better GI system. Everything gets better if you can do these things naturally, if you can empower yourself. Things like resveratrol or pterostilbene, which is from blueberries, these are extremely powerful plant-based antioxidants that reduce pain. I just read a great study where they actually combined resveratrol and Mobic for knee arthritis, and it worked wonderfully. Better than Mobic alone, better than placebo. So I love resveratrol. I take it for longevity, for brain health, and for the nootropic aspects of it. But I also take it because it's a very strong antioxidant. And I know with stress and the American diet and the pollution around me, I have constant attacks of oxidative stress. So I take resveratrol to fight that off. And it does treat pain. Alpha lipoic acid is a great antioxidant that goes into the fatty cell layers and also the more hydrophilic or water-loving cytosol. So it can actually function as an antioxidant on both sides. Also been shown to reduce pain. In fact, that's one of the frontline treatments or first-tier treatments in Europe for diabetic neuropathy is ALA. Chlorella is an algae that detoxes or chelates heavy metals. Remember I told you heavy metals are a toxin that can cause pain? Anything you can do to pull heavy metals out of your system, from sweating in a sauna to exercise to taking chlorella and other chelators, ALA2, helps. Turmeric is another great natural anti-inflammatory. Okay, PEA we talked about a bit, palmitoyl ethanolamide, a natural fatty acid amide. It's in the same family of substances as is what CBD upregulates, anandamide and 2-AG. So it is one of the ligands or neurotransmitters in the endocannabinoid system. So this regulates the inflammation around peripheral nerve endings. PEA is strongly recommended for chronic neuropathic pain conditions like diabetic neuropathy, arachnoiditis, things like that. It's very natural. You make it yourself in your own body. You're just not making enough if you have neuropathic pain. Alpha lipoic acid, we talked about that too. Additionally, same as PEA, same as anything natural, you're never going to get that single molecule sudden change in how you feel like you do with synthetic drugs. Most of the synthetic drugs either turn on or off an enzyme, so you get a quicker effect. The ALA is an antioxidant. It has to be incorporated into each cell's antioxidant system, so it takes a number of weeks. I tell people to give natural medicine 2 to 3 months before they try to decide if it helped them or not. Basically, it helps the calcium channels function better and more appropriately, which remember is very important at that terminal bud at the synaptic cleft. And actually, they've studied ALA and it gives more pain relief than placebo. It's very, very safe. And if you combine it with CoQ10, it works even better for things like peripheral neuropathy. Because CoQ10 is it's an antioxidant too, but it's mandatory for the electron transport chain. So you cannot make ATP, that energy you need for that pump, without CoQ10. So the two together is very, very good for neuropathic pain. So those are just some of the natural things you can do that are much safer than the drugs we prescribe and have as good or better results.